Tapeworm infection, known scientifically as Taeniasis, is a condition that occurs when a person ingests tapeworm larvae or eggs, which leads to the development of adult tapeworms in the human intestines. Tapeworms are parasitic flatworms belonging to the class Cestoda, and they thrive in the digestive tracts of their hosts, including humans. They are given this name for their ribbon-like appearance, resembling a long, segmented tape. These worms can grow to impressive lengths, with some species reaching up to 30 feet long in extreme cases. The infection is most commonly associated with the consumption of undercooked or contaminated meat, particularly beef, pork, and fish. A tapeworm infection typically begins when a person ingests tapeworm eggs or larvae. Once inside the human digestive system, these larvae, whether ingested directly or hatched from eggs, use small hooks or suckers to attach to the intestinal wall. From this position, they absorb nutrients directly from the host's digestive system, enabling them to grow to considerable lengths, sometimes reaching several meters. In some cases, particularly with species like the pork tapeworm, the larvae may not stay in the intestines. Instead, they can burrow through the intestinal wall and travel through the bloodstream to other parts of the body, potentially forming cysts in muscles, organs, or even the brain. This condition, known as cysticercosis, can be much more serious than an intestinal tapeworm infection. Types of tapeworm infection. Tapeworm infections vary greatly depending on the species of tapeworm involved. The pork tapeworm, also known as Taeniasis, is particularly dangerous because it can cause cysticercosis, which is the condition where the larvae migrate to other parts of the body. The beef tapeworm, or Taenia saginata, on the other hand, tends to cause less severe symptoms because it primarily stays confined to the intestines. However, it can still grow to be extremely long, sometimes over 10 meters, and cause discomfort and digestive issues. The fish tapeworm, or Diphyllobothrium latum, is another common species, particularly in regions where raw or undercooked fish is commonly consumed. This tapeworm can cause vitamin B12 deficiency because it competes with the host for this vital nutrient, leading to anemia and other related symptoms. The World Health Organization estimates that up to 50 million people worldwide may be infected with the pork tapeworm alone. Causes of tapeworm infection. The causes of tapeworm infections are directly linked to the consumption of contaminated food or water. The most common route of infection is through eating undercooked or raw meat from infected animals. For example, the beef tapeworm is transmitted when people consume beef that contains tapeworm larvae, called cysticerci. These larvae are small, fluid-filled cysts that contain the immature form of the tapeworm. When ingested, the larvae develop into adult tapeworms in the human intestine. Similarly, the pork tapeworm is acquired by eating undercooked pork containing cysticerci. The fish tapeworm is also contracted by consuming raw or undercooked freshwater fish. In some cases, tapeworm eggs can be ingested through contaminated water or food that has been in contact with feces from an infected person or animal. This is particularly true for the dwarf tapeworm, which can be transmitted directly from person to person through poor hygiene practices. It's important to note that tapeworm infections are more common in areas with poor sanitation, inadequate meat inspection practices, and where eating raw or undercooked meat is customary. However, with global travel and diverse culinary practices, tapeworm infections can occur anywhere in the world. Symptoms of tapeworm infection. The symptoms of a tapeworm infection can range from mild to severe, depending on the species and the location of the tapeworm in the body. In many cases, people may not experience any noticeable symptoms at all. This is one of the reasons why tapeworm infections can go undetected for long periods. When symptoms do occur, they often develop gradually and can be quite subtle at first. One of the most common symptoms is abdominal discomfort. People with tapeworm infections might experience a vague sense of fullness, mild pain, or cramping in their abdomen. This discomfort is caused by the presence of the tapeworm in the intestines and the irritation it causes to the intestinal lining. Weight loss is another potential symptom, despite an increase in appetite. This seemingly contradictory situation occurs because the tapeworm is consuming nutrients from the food you eat, leaving you feeling hungry but potentially losing weight. Some people might notice an increase in their appetite, as their body tries to compensate for the nutrients being stolen by the parasite. Nausea and diarrhea can also be present in tapeworm infections. The presence of the worm can disrupt normal digestive processes, leading to these gastrointestinal symptoms. In some cases, people might experience constipation instead of diarrhea. One of the more unsettling symptoms, which often leads to diagnosis, is the presence of tapeworm segments in the stool. These segments, which contain tapeworm eggs, can sometimes be seen in the toilet bowl or on toilet paper. They often resemble small pieces of white rice and may even move. In cases where the tapeworm larvae migrate to other parts of the body, more serious symptoms can develop. Cysticercosis caused by the pork tapeworm can lead to a wide range of symptoms depending on where the cysts form. If cysts form in the muscles, they can cause lumps under the skin, which may be tender or painful. If they form in the eyes, they can cause vision problems or even blindness. The most severe symptoms occur when cysts form in the brain, a condition known as neurocysticercosis. This can lead to headaches, seizures, confusion, balance problems, and in severe cases, death. This is a major cause of epilepsy in some parts of the world. Diagnosis of tapeworm infection. When a person presents with symptoms suggestive of a tapeworm infection, a doctor will typically start by taking a detailed medical history. They'll ask about recent travel, dietary habits, especially consumption of raw or undercooked meat, and any contact with potentially infected individuals or animals. The most common and straightforward diagnostic method is a stool test. This involves examining a stool sample under a microscope to look for tapeworm eggs or segments. However, because tapeworms don't continuously release eggs, multiple stool samples over several days may be necessary to confirm the diagnosis. In cases where cysticercosis is suspected, imaging tests such as X-rays, CT scans, or MRIs may be used to locate cysts in the body. Blood tests may also be performed to check for antibodies to the tapeworm, which can indicate an active infection. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for tapeworm infection. The primary goal of treatment is to eliminate the tapeworm from the body completely. This is typically achieved through the use of antiparasitic medications. The most commonly prescribed medications for tapeworm infections are praziquantel, niclosamide, and albendazole. Praziquantel is often the drug of choice for most tapeworm species. It works by paralyzing the tapeworm, causing it to detach from the intestinal wall. The paralyzed worm is then passed out of the body through normal bowel movements. Praziquantel is usually given as a single dose and is effective against most tapeworm species. Niclosamide is another effective medication, particularly for beef and fish tapeworms. It works by damaging the tapeworm's skin, causing it to dissolve within the intestine. Unlike praziquantel, niclosamide is not absorbed into the bloodstream, which means it has fewer side effects, but is also not effective against tapeworm larvae outside the intestines. Albendazole is sometimes used, especially in cases of cysticercosis. It's effective against both adult tapeworms and larvae, making it useful in more complicated cases. However, it typically requires a longer course of treatment compared to praziquantel or niclosamide. After taking the medication, it's common for patients to pass the tapeworm in their stool. This can be a disconcerting experience, but it's a sign that the treatment is working. In some cases, the tapeworm may come out in pieces rather than as a whole worm. In addition to medication, supportive care is often recommended. This might include increasing fluid intake to prevent dehydration, especially if diarrhea is present. In cases of severe infections or complications, hospitalization may be necessary for more intensive treatment and monitoring. Prevention of tapeworm infections. First and foremost is proper food handling and preparation. Cooking meat thoroughly to an internal temperature of at least 145 degrees Fahrenheit or 63 degrees Celsius for whole cuts and 160 degrees Fahrenheit or 71 degrees Celsius for ground meat will kill any tapeworm larvae present. Freezing meat at -4 degrees Fahrenheit or -20 degrees Celsius for at least 24 hours before cooking can also kill tapeworm larvae. Good hygiene practices are essential, especially in areas where sanitation may be poor. This includes washing hands thoroughly with soap and water before eating and after using the bathroom. When traveling in areas where tapeworm infections are common, it's advisable to avoid raw or undercooked meat and fish, and to drink only bottled or boiled water. For individuals who keep pets, regular deworming of dogs and cats can help prevent the spread of certain tapeworm species. It's also important to dispose of pet feces properly and to wash hands after handling pets. Now, we want to hear from you. Do you or someone you know have a tapeworm infection? What symptoms did you have at first? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.